everyone. You're likely here because you want to get straight to the important stuff on complex topics, right? Cut
No.
through the noise.
Exactly. And that's what we aim for.
Today, we're doing a deep dive into something quite specific in the veterinary world. Canine infiltrative lipoma. It's a fatty tumor, but not the usual kind.
Right. Consider this your focused guide. We've looked at a detailed medical overview to pull out the essential bits for you.
Yeah, our mission today is pretty clear. Understand what infiltrative lipoma actually is. Why is it so different from a regular lipoma?
And why isn't surgery always a simple fix? That's a big one.
Definitely. And also, what's the deal with radiation therapy? There are some, key points that make this condition, interesting and important to understand.
Okay, let's jump in. The word that really matters here is infiltrative.
Mm-hmm.
So a normal lipoma, it tends to stay contained, almost like it's in its own little bag. But this type, it doesn't follow the rules. It sort of sends out fingers, grows into the tissues around it.
Exactly. And it's not picky about where it goes. The source material says it can pop up in all sorts of soft tissues. Muscle is really common, apparently.
Yeah, extensive muscle infiltration is typical. But also fascia, tendons, nerves, blood vessels.
Even things like salivary glands, lymph nodes, the capsules around joints, and sometimes, believe it or not, bone.
It's that ability to spread locally. That's the key difference.
And it's much less common than the regular kind, right?
Oh, much less frequent. So, if your dog has a fatty lump, the odds are it's not this infiltrative type. Still, important to know about.
So which dogs tend to get this?
Well, the info points towards middle-aged dogs, typically.
Okay.
There's also a mention, sort of an observation, really, that maybe Labrador Retrievers are seen with it a bit more often.
But no definite proof?
No, exactly.
Yeah.
No proven breed predilection. So we can't say for sure labs are more at risk.
And anything about male versus female dogs?
There's a suggestion it might be more common in females, but again, it's not a solid conclusion, just something noted in the data.
Interesting. So a bit hazy on the who gets it front, which probably doesn't make spotting it any easier.
Probably not.
So what might you actually see on a dog? What are the signs?
Typically, you're looking at a large, kind of diffuse soft tissue mass.
Yeah.
It doesn't always feel like a distinct lump.
Right. So maybe just localized muscle swelling, or if it's in the belly.
Could even make the abdomen look distended, yeah.
And where do they usually show up, location-wise?
The common spots seem to be the big muscle groups, pelvic area, thigh, shoulder, chest, or sternal area, and the side of the neck musculature.
Okay.
But interestingly, the source also mentions that more recently it's been found that predicting the exact site is actually pretty difficult.
Huh. Adds another layer of complexity. Now, what about the big question, why does this happen? What causes it?
Yeah, the short answer is we don't know.
Really?
The causes, the risk factors,
Mm-hmm.
currently unknown, which is, frustrating when you're dealing with any condition.
Absolutely. Does not knowing the cause make it tougher to diagnose or treat then?
It certainly doesn't help. And diagnosis. That brings its own challenges. Figuring out for sure that it's infiltrative lipoma is tricky.
Because other things can look similar.
Exactly. And some of those other things are much more serious. We're talking soft tissue sarcomas, nasty stuff like liposarcoma, which is actually cancer of fat cells.
Okay.
And others like hemangiopericytoma, myxosarcoma, rhabdomyosarcoma, fibrosarcoma, all malignant.
Wow. So distinguishing it is critical.
Crucial. And you also need to rule out regular benign lipomas and something called intermuscular lipomas, which are also fatty but behave differently.
What about the usual first steps, like blood tests or urine tests?
Generally, those come back normal. They don't really point towards this specific problem.
So not much help there. What about looking inside? Imaging.
Right. Imaging is key. X-rays might show tissue that looks like fat density mixed in with other soft tissues.
Okay. A clue, maybe.
And then CT or MRI scans give a much better view. They're really useful for planning, if you're thinking about surgery or radiation.
I sense a butt coming.
Well, yeah. Here's the tricky part. Even with CT or MRI, it can be really hard to tell the difference between the infiltrative lipoma and just normal fat.
So you can't always see exactly where the tumor stops and the normal tissue starts.
Precisely. That makes judging the true extent very challenging.
Which leads us to needing more definitive tests, I assume, like taking a sample.
Yes.
Huh.
So a fine needle aspirate where you just stick a needle in and get some cells might be done first.
And what does that show?
It usually just shows mature fat cells that look completely normal,
Yeah.
identical to regular fat.
So that could be misleading, make you think it's just a normal lipoma.
Exactly. It can definitely be misleading.
So the key takeaway here is,
You need a tissue biopsy, an actual piece of the tissue examined under a microscope. That's required for a definitive diagnosis.
right, you need to see the structure.
Precisely. And what the pathologist looks for isn't abnormal cells per se. The fat cells themselves look well differentiated, quite normal actually.
So what is the giveaway then?
It's seeing those normal-looking fat cells infiltrating,
Yeah.
growing into and between the muscle fibers and other tissues. That invasion pattern is the diagnostic hallmark.
Okay, that makes sense. It's about the behavior, not just the cell type. So treatment. Surgery seems obvious, but you mentioned challenges.
Huge challenges. Because it invades and the edges are so poorly defined, getting it all out surgically, achieving what we call clean margins, is extremely difficult.
Like trying to remove smoke from the air.
Huh. Yeah, that's not a bad analogy. It's just
Yeah.
interwoven. Hard to separate the tumor from the normal fat and muscle visually during surgery.
And I guess that leads to it coming back.
Very often, yes. The source quotes a recurrence rate of somewhere between 36 and 50% within about 3 to 16 months after surgery alone.
Wow, that's high. So sometimes more drastic surgery is needed, like amputation if it's on a limb.
That's sometimes considered, yes. But the recommendation is generally only if the dog's quality of life is really suffering. If it can't move properly, it's in pain, or the tumor is messing with vital structures.
And timing is important there.
Crucial. If amputation is the way to go, it really needs to happen before the tumor grows too far up the limb, basically crossing the line where you can actually perform the surgery successfully.
Okay. So surgery is tough. What else is in the toolbox? You mentioned radiation earlier.
Yes, external beam radiotherapy. The overview presents this as being pretty beneficial for long-term control.
How beneficial?
Well, there was a retrospective study mentioned that found a median survival time of 40 months with radiation.
40 months? That sounds pretty good.
It is. And significantly fewer dogs in that study needed euthanasia because of the tumor compared to dogs who only had surgery.
That's a significant difference. Does radiation always shrink the tumor completely?
Not necessarily. The source notes that if there's measurable disease, meaning you can still see or feel the tumor radiation, might mainly just stabilize it, stop it from growing further.
Okay, so stabilization is still valuable.
Definitely.
Yeah.
But there's also a potentially better approach mentioned, combining surgery and radiation. Specifically, doing cytoreductive surgery first. That means removing as much of the tumor bulk as possible, ideally down to just microscopic levels.
And then following up with radiation.
Exactly. That combination seems to offer the best shot at long-term control, sort of a 1-2 punch.
Makes sense. Any medications specifically for this? Pills or injections?
According to the source material we reviewed, no. There aren't specific drugs listed for treating infiltrative lipoma itself.
Okay. So after diagnosis, after treatment, what kind of follow-up are we talking about? How do you monitor these dogs?
Monitoring is mainly focused on deciding, well, when might be the right time for more surgery, or for adding radiation if the first surgery didn't get everything.
So checking for regrowth.
Essentially, yes.
Yeah.
How often they need rechecks depends on how fast the tumor seems to be growing, if at all, and which therapy was used.
Are there side effects to worry about from the treatments, particularly radiation?
Radiation can have temporary side effects, yeah.
Yeah.
Things like moist skin irritation, kind of like a bad sunburn, or hair loss in the treated area.
Okay.
It's always best to talk to a radiation specialist or radiation oncologist because side effects can really depend on the exact location being treated.
Right, makes sense. So zooming out again, the big picture, what's the overall outlook, the prognosis?
The good news, really, is that long-term control is possible, using radiation either by itself or, perhaps better, combined with surgery.
And because it doesn't tend to spread elsewhere in the body?
Exactly. It lacks metastatic potential. So once you get that local growth under control, the prognosis is actually considered very good.
That's definitely a positive note. Is there any but or caveat there?
There is one really important one.
Okay.
You have to be absolutely sure the diagnosis is correct. If it turns out it wasn't infiltrative lipoma, but actually liposarcoma, the malignant fatty cancer.
Then it's a whole different ballgame.
Completely different. The behavior, the prognosis, the treatment. You'd need to look at information specifically about liposarcoma in that case. So that initial accurate diagnosis is just critical.
Got it. So let's quickly recap the key points from this deep dive. Infiltrative lipoma. It's rare compared to normal lipomas. It's benign. meaning not cancerous.
But it's locally invasive. It grows into tissues, which makes surgery alone often difficult and recurrence common.
Right. And diagnosis isn't straightforward. You absolutely need a biopsy to see that infiltrative pattern.
But the good news is that radiation therapy, especially when potentially combined with surgery to reduce the tumor size first, offers a really good chance for long-term control.
And because it doesn't metastasize, the overall prognosis can be very good if you manage the local growth.
It's definitely one of those less common conditions, but understanding it is pretty important, whether you're a dog owner or work in the veterinary field. It shows how even fatty lumps aren't always simple.
Absolutely. Which leads to a final thought for you to consider.
Given how tough it is to tell this infiltrative fat apart from normal fat, both on scans and during surgery, what kind of future breakthroughs might help?
Yeah, could we see advancements in imaging, maybe? Or new surgical tools or techniques that could more precisely identify and remove just the tumor tissue, leaving the healthy stuff intact?
It's definitely an area where more precision could make a real difference for these dogs. Something to think about.